of something so important.
I never saw this happening in this way exactly. I always wanted to work in medical research and do something that through science and through research would improve human health. So I'm very pleased that I've finally been able to do that after many, many years of research.
And you've managed to have this incredible career alongside raising triplets. And the only reason why I'm bringing that up actually is that you have partly credited your recent success with juggling work and family life.
Mm-hmm. Well, I think if you can get through bringing up very young children, 3 of them all the same age, while still working full time and maintaining a career, then you know you can do difficult things. It's very difficult to do something like that, but women do that kind of thing, and I think we should then allow that to give us confidence that we can do more difficult things at other parts of our career.
Yes, inspirational is a word there, isn't it? In the past, you have said that you've considered leaving science. I bet you're glad you didn't.
I am very glad I didn't. It's difficult to have a career in science. There are stages where things aren't going well. There are difficulties in getting research done sometimes. It's challenging, but I decided, I had a good think about it. I thought about doing something else instead, decided I really wanted to give it another go, and I'm very glad now that I stuck with it.
And of course, the work doesn't stop here, does it? For us non-sciencey types, explain what you're working towards now. What's the goal?
So now what we're doing is continuing to analyse the data that comes out of the clinical trials that we started last year, but we're also working on new versions of the vaccine, which have a slightly different version in them to tackle the different variants that are out there. And this is very much work in progress. We're making a number of different versions, and we'll have a look at them, and then we'll do some small clinical trials and decide if and when we want to make a change and introduce an updated version of the vaccine.
Well, we wish you the very best of luck with that. Thank you so much for taking the time out to speak to us today.
Thank you.
Yeah, great. She's not resting on her laurels either. Keep going, which is good. Well, millions have already benefited from Sarah's work, of course, among them those with learning disabilities who are having their COVID vaccinations after a government advisory group accepted that they should be prioritised.
It follows a passionate campaign led by radio presenter Jo Wiley, whose sister contracted COVID after an outbreak